everyone, and welcome to our third annual Autism Hope Summit. You guys are in for a real treat right now. We have just an amazing speaker. I have known this man for, I think, since the beginning of my autism journey. Dr. PhillipDeMio, he is a world-renowned doctor. I can't even express to you how lucky you guys are to be able to have him right now as one of our speakers. So thank you so much for being here, Dr. DeMio.
Thank you for the privilege, Kristen. It's nice to talk to you.
Absolutely. I remember meeting you, gosh, I want to say it was about 14 years ago.
I think I was going to say 14, and yeah, that's gone fast, hasn't it?
It really has. And so today I know we're going to be talking about Lyme disease, what is it, and really what is the connection with the autism spectrum. However, before we do that, I want people to know your background, because I personally know your background. I know how brilliant you are, but I would love for the audience to get a better picture of who you are and why you do what you do, and why are you so passionate about the autism community.
Well, our patients are brilliant, and they're the ones who have taught me. The autistic child, kids with autism, kids with Asperger's, adults with these problems often do not get credit for their intelligence. They have high energy, and so do the parents. And that energy has driven them to overtly show the need that they have, and I've learned from them. I never saw a case of autism till my son regressed into autism. I was a physician for some years at that time, and I believed, like everyone else, because I was taught that autism was extremely rare, and I couldn't have quoted you when I finished medical school or before seeing my son's issues how much autism there was. I would have told you it was rare, and I might have told you there was 5 or 10 autistic kids in the whole country, because I didn't know. I wasn't taught that, and it's partly because there was much less autism beforehand. So we had a child who was a beautiful, wonderful child, born healthy and normal. My dear wife Joyce and I, and she says hi to you, by the way, and to all of the listeners and so on. And we did what any parent would do when something goes wrong with their child. We sought help from people who should know. And that included, largely, not entirely, physicians. And not only were they not of any help, but sometimes they were dismissive, antagonistic, and were negative. So we left with less than we had when we brought our dear son, who was delving into deep regressive autism. It was horrible. He was just the most beautiful thing I'd ever seen when he was born. And within a half hour after his first vaccination, he changed and got very sick. Half hour into life, he started vomiting. He lost tone. He started crying a few hours later. And then he had waxing and waning, and we, looking back, noticed that he got sick for some weeks after each set of vaccinations. And one set of vaccines, when he was sick with a cold, when he was about 18 months old, led him into severe regressive autism, and we really never got him back. We've had some improvements, but we never got him back after that. So we were insiders first, and we, through my wife's obstetrician, were told that there was a family that he had delivered their child. Their child regressed into autism, and they recovered him with medical treatment. And boy, did that get our attention. So he connected us with that couple, and they mentored us about diets and about medical care of several types of things that we could do to help our son to not get worse and to get better. And those things worked. It wasn't easy, it wasn't perfect, but they helped. He certainly stopped getting worse, and he has gotten somewhat of a recovery. He's about 50% recovered. And he didn't know who I was. He stopped talking. He had 3,000 words when he was 18 months old.
Wow. And
he lost every single word. Every single word. So I was taught in medical school, if there was a neurologic disorder like that in a child, that they were going to die. Currently that's called Disintegrative Disorder, or there are other names for that. I think you've heard that name. Many of the parents have. Our son did not die. He's going to be 18 soon. And he is much healthier than he would be if we didn't do these medical treatments. I then started trying to help other parents to get this kind of help. And then eventually I went to various conferences, connected with other parents and other doctors, and basically got what amounts to a residency, if you will, or trained in this area, and began to help other people at a medical facility that we now have, and that's my medical offices. And so I recently saw a 3-year-old. I recently saw a 2-year-old. I recently saw a kid who was 10 months old. And sadly, the same story's out there. And really, parents are not given the right information and they don't have the treatment. That's what drives myself and my wife to try to help others. And that's what we do. And that's where it came from. Really, my son was my first teacher.
Yeah, and I think that so many of the doctors out there, you hear that, you know, we didn't hear anything about this in medical school, or we were told we would never see a child really with autism. And then it happens to you guys. And then I don't want to say thankfully it happens, because I wouldn't want it to happen to anybody. Yeah. But, you know, it's without you guys helping parents like me. You know, imagine if no doctors were out there and every doctor thought this was not treatable. And, you know, our kids would be left with constipation and diarrhea and headaches and seizures and, you know, and everything else. So thank you for being one of the pioneer, I really feel the pioneer doctors out there making a difference.
Well, it's because the parents made it clear that they weren't getting what they needed in their children. You know, the kids are the focus here. Now some of those kids are adults. And we see people who have bits and pieces of the spectrum that come to us. They have an autistic GI tract with severe constipation or horrible diarrhea or malabsorption. Saw a 15-year-old just 2 days ago, wonderful young lady, cognitively normal except for the PTSD she has through the way doctors mistreated her and her mother and her family. And she was locked in a psych facility for some months after losing weight because she couldn't absorb food. And they immediately assumed, the doctors, that her parents were randomly mistreating her and treating the other kids in the family normally. And so she had absolutely no signs of maltreatment when I saw her. She was a wonderful young lady, but deals with her PTSD that she had from all this terrible ordeal and has horrendous GI problems. Many of the siblings of the autistic children have horrendous food allergies. Terrible eczema. I mean, head to toe, every square inch. You know this. You've mentored many people through your dietary expertise and advice and other components, and you see kids that you've tried to help them with therapy of various kinds who have physical problems. The physical problems get ignored. If you look in Leo Kanner's original, Dr. Kanner was the one who coined the term autism. Autistic disturbances of affective contact in his famous paper in 1943. He highly cataloged, being one of the early pediatric psychiatrists in Baltimore, highly cataloged all the medical findings in several children. One of them, named Daniel, was like my son, Daniel, lots of GI problems, lots of respiratory infections. And then he roundly ignored those and then went on to talk about the psychiatric part of it. And he wasn't a bad guy. I think he was a good guy for characterizing it. But these kids had vomiting. One of them had a feeding tube, which in those days was not very common, that he couldn't eat for a year or something like that. You know, we had a feeding tube for Daniel so we could give him his supplements from a surgeon who did some good things for him at that point. And it really helped him. And the surgeon couldn't believe on follow-up how much improvement he had just to get some of the supplements in. But the same surgeon said there's no reflux when he put the feeding tube in. The first dose of fish oil we gave him ended up in his mouth. That's reflux, you know, wow, through the tube. So doctors still don't understand, because I think there's a mental block there and it's politics, but that's why we still do it. And the need for patients that they do have for us is ongoing. Our oldest patient, Doug, is going to be 67.
Oh, wow.
67. He's our oldest with frank autism. Our oldest one with ADHD is Bruce. Bruce is a very successful business person, but he's under another business because he can't do the whole 9 yards because he's got too much focus attention issues. They're better, but he can't do it. He would be, you'd know who he was, and he'd be the head of a big company if he didn't have all these spectrum issues. He worked for someone else, because he can only manage a smaller number of people working under him. And Bruce is probably 77 now.
Wow.
And Bruce has chronic influenza. If he goes off of his amantadine, which is one of the medications that I think people are familiar with, 3 days later he's in bed with a fever of 103, muscle aches. That's a physical problem. That's part of the basis of his problems. So autism, Asperger's, they have a medical basis, and that's why a doctor like me is motivated to treat them.
Absolutely. Well, now, one, I love that you can treat at any age, and I think that anyone watching, obviously, listen, I mean, there's people that are 2, 15 months, 72, so, you know, put that out of your mind if you think that your child's too old, or I love, like, oh, by the time they're 8, like, that's just crazy sauce. So today we're going to talk about Lyme disease, because I know that I would say I'd say for me, I probably really have heard about Lyme disease and autism probably this last decade. It seems like, you know, you're kind of hearing it pop up and then go away, pop up, go away. But now suddenly, it seems like really the last 5 or 6 years, we're hearing more and more families really start talking about this. You know, so first of all, what is Lyme disease so that people can really understand?
Lyme disease is an infection. It's a bacterial infection. So we have all kinds of germs out there, and bacteria are the hardest ones for primates, humans, mammals to deal with. And there are fast-growing, rapid, greedy germs, strep and staph and things like that. They don't hide. They don't sort of take their time. Then there are slow-growing germs like leprosy, and slow-growing germs like some forms of things like these chronic infections such as shingles and things that are dormant in the body for decades. And they grow very slowly. And some of these slow viruses that you hear about that cause dementias and all kinds of physical problems, and do so over several decades, several years, several months. Lyme can do all of this. And the types of Lyme that have a hard time coming to medical attention are the long-term chronic ones. So Lyme is a tick-borne illness. And so ticks, and some of them are really tiny, and the smallest group of them are the Lyme-carrying ticks, and many ticks and other bugs can carry Lyme. And that's the major way that most people and most doctors are familiar with the way a person gets infected with Lyme disease.
When you say other bugs, because, I mean, obviously being in the autism community, I've heard this before, but I remember the first time I heard it, I thought only ticks could be a carrier of Lyme disease, but I know, talking to you and other doctors, there's mosquitoes, spiders, and other bugs, correct?
That's right. So you'd get an A in medical school if you told your professor and answered on the test that only ticks carry Lyme, and you'd further be told that only the ixod ticks, the smaller brownish ones, carry Lyme. First of all, the Lyme germ has been found in other ticks, the dog ticks, the wood ticks, the Lone Star ticks. Lone Star is the easiest one to identify. The females have that white dot on the back, a little smaller than a pencil lead area, or about that size. And so the trick is that the tiny ticks that are larval and these little nymph forms that are the size of less than a grain of sesame can bite and carry the Lyme germ, and it's very, very tricky. They anesthetize the skin, they walk very light, and the smaller ticks are hard to see. So you, for example, have the type of hair they'd like. It's dark, it's straight. Once they take their time, and they can take hours to do it, and get down to your scalp where the skin is warmer, softer, and has more blood vessels, then they sink in, and they can stay there for weeks. And they can feed and inject the Lyme germ while they do this. And people may not even know they've been bitten. So those bugs can carry Lyme. If you take an experimental cage with mice in it and have Lyme-laden ticks and they bite the mice and the mice get Lyme, then you take ticks that don't have Lyme and put them into that cage after taking the other ticks out. Then those second set of ticks can get Lyme from the mice when they bite the mice. You take those ticks out and put them in a cage where mice don't have Lyme, and they'll transfer the Lyme to the second set of mice. You can do the same thing with spiders.
Wow.
You can do the same thing with mosquitoes, fire ants, other types of ticks, not the ixide ticks, other types of ticks. You can do that with other germs, Babesia and some other germs. And so it's harder for the other ways to get that transferred, but bugs are the major way it happens, and the farther south you go, the more variety of bugs there are. But I would say spiders and ticks are the biggest way it happens in the Northeast and the northern U.S. and Canada.
Now, what about when we're looking at co-infections?
Yeah, it's a good question. Yeah. So people have heard about co-infections. That's when you have Lyme and something else at the same time, another germ. About 2/3 of the time, those other germs are also tick-borne. So Ehrlichia, Rocky Mountain spotted fever, anaplasmosis, tularemia, excuse me, are the ones that are well known to be tick-borne. Now, many of those germs can also be, tularemia is a great example, handling small animals. Some people are very good. They're the whisperers of these little wild animals that'll come up and feed from them. They can, just from touching and handling the animals, and some trappers. We have trappers in Ohio that have the tularemia. So they may not get it from ticks, but they can. So a lot of those co-infections are from ticks and other bug-borne illnesses. Babesia is a parasite that is very similar to malaria, but it's cold weather malaria, if you will. And it's from mosquitoes and ticks. And the farther you go south, the more it's from mosquitoes. Central America, the farther up into the mountains and farther north you go, the more it's from ticks. It's very similar to malaria. Toxoplasma is another parasite. And these one-celled parasites, which are the so-called protozoans, are the ones that are often bug-borne. I had a case of a very nice young man who's an accountant that was noticing he was unable to think straight. And he went to many doctors, and they told him, you're just stressed and you're getting older. He's 27 years old.
Oh, my goodness.
Well, he might be older than he was when he was 19, but 27 is not a disease. And when a 27-year-old can't think straight, when they've regressed and lost mental function, something's wrong. A colleague of mine who he saw, who's an alternative doctor, who's thought of as a left-wing alternative doctor by other critical doctors, after those doctors, with sincerity, tested him for several things, were very dismissive of him and wanted him to see a psychiatrist and go on psych medication. He obliged them, respecting his doctors, no help, had side effects from the treatments, was a little bit traumatized, to say the least, from the treatments that some of these mental health people gave him. They're good people, but they didn't think that he had a mental problem, and they sent him back to the doctors. Eventually, he on his own went to the alternative doctor, functional medical doctor, who did, among other things, Lyme testing. This man does not remember being bitten by a tick. He had a frankly positive, unequivocal test for Lyme disease, blood test. So the slow-growing germs that take their time to make their way slowly and deeply into our tissues, into our brains, into our immune systems, into our GI tracts, and he has it all. Don't show up on cultures and smears and things. You need blood counts, and the blood counts aren't great, so you have to put the picture together because the picture of the patient is what's great. So those other doctors did tell him what he doesn't have, and that other physician knew that she didn't have to look there, and she looked where she thought that they might have looked, and he has Lyme disease, but he also has Toxoplasma in his muscles and in his GI tract, a parasite. And so that's his co-infection. So we look for co-infections. Then the other class of co-infections would be familiar things like some of the chickenpox, cold sore, HHV6 viruses, mycoplasma, all right, some of the adenoviruses, Coxsackie viruses. Those aren't tick-borne. A few of them may be tick-borne in rare cases, but they're not by and large. That's when the immune system gets so sick that one of those germs took over first, then all the other germs had a much easier time, one at a time, piling onto the patient. He has several, but the two main actors in his case are Lyme and Toxoplasma, so we're treating him for both. And it's almost the rule that people who are sick enough to have long-term Lyme, to lose brain function and so on, would have cognitive problems, weak immune system, and usually several co-infections. And so it goes with the children who have autism and Lyme. They have a combination of all these things.
Now, quickly, why is it that the mainstream medicine, and I know this even, I had thought for a moment, I think it was about 2 years ago, I'd gotten a random bite at a hotel, and I thought maybe it was a tick. You know, I wasn't sure because there was like a weird ring around it or whatever.
Yeah.
Yeah, and I had went to the ER after because I wasn't feeling well. And I'd gotten tested, and luckily, I mean, no symptoms. After that, I felt better and everything, but they did not want to test me for Lyme. And I remember saying to them, but it could have been a spider, because they said, well, maybe it's a mosquito, maybe it's a spider. I said, but even if it's a mosquito or a spider, that could still carry Lyme. And they looked at me like I was crazy, like cuckoo for Cocoa Puffs. And I said, no, and I even pulled up like on my phone to show them.
Yeah.
You know what that doctor did in the ER? He went somewhere on a computer. He printed up from the CDC showing that it's only from ticks. So for those that are, watching, and you're going to get people that are going to Google and look. Why is it that they are so persistent to say that it only comes from Lyme? Like, what benefit does it have for them not to recognize that it's coming from other, bugs?
Yeah, I'm nodding because I understand your question, and I have heard that story umpteen times. One of our patients, the dad, the mom, and the small child who was kind of in Little League sports, they were having a playoff series, if you will, and they went the next state over into a hotel on the first floor during, a warm weather period of time. And the maintenance people had the back door of the hotel open, and they were all sleeping in the same room, in the same bed. And the child and the mom were closer to the door. They ended up getting Lyme, and they had seen some bugs coming in and out of the hotel through that open area, and they were very convinced that some kind of bug crawled in. And they had big bullseye rashes, which is a classic kind of rash, the EM rash, it's called, which in and of itself can make the diagnosis of Lyme disease. That's one of the criteria for that, for a doctor to be able to hang their hat on it and treat it before it becomes chronic, before there's neurologic regression, before the person's joints are damaged. And small children and people under 30 can have very severe heart problems. Children who are 3 have died from cardiac arrest from Lyme, and 15-year-olds and young adults, 20s to 30s. We don't see it very often in the older adults, thank goodness, but we certainly know that it does happen in young people. She was told that she was indoors and that couldn't happen. Well, we had a tick in our house in the middle of winter when it was 9 degrees outside.
Oh, wow. Because
I saw mice trails in the, my wife's from Maryland, and so she can spot a tick a mile away. So she thought a tick was crawling in our foyer near our son. Thank goodness it didn't bite him. She saved the tick. We had it tested middle of winter in northern Ohio, had Lyme inside of that tick. The mice will walk around. There were mouse trails under the dusty snow in front of our home. And, any foundation's going to have cracks. The ticks sense warmth, and they sense moisture, and they love to go toward those things. And they can sense the CO2 produced by animals, and that's what they seek. So that tick, I'm sure, somehow crawled into our house. It was a smaller tick, and it had Lyme in it. And so, these ticks are very good at what they do. So you'd have to, in the short answer, ask these other doctors, many of whom are sincere, but they're very firm and very black and white, why they have their beliefs that they do have that are contrary to a huge body of scientific knowledge, none of it controversial. Just gave a similar discussion with one of the legislators in Ohio who had 3 scientists and a person who has Lyme on a panel. The bug expert, the entomologist, has said for years that we have lots of Lyme in Ohio and lots of Lyme germs in the ticks and other bugs in Ohio. Doctors to this day in Ohio and other states are still telling patients that you cannot sustain a case of Lyme in Ohio.
Oh my!
For example, doctors in California are still telling patients that you cannot sustain Lyme in California. It doesn't exist.
I know that's where I was at in the ER, and they said there was no such, and I made them test me for Lyme, and then I worked with my doctor and did like a short treatment for Lyme just in case, because it was a bull size, ring, looked like a ring around the bug bite. I didn't have any symptoms past that, but because of what I knew that it was better safe than sorry. And so now let's talk about Lyme and autism, because we're just seeing this more and more and more. So, what is the connection between autism and Lyme disease?
Well, the fact of the matter, there is a connection. And when you just look at it from the top down, you have a child with autism, particularly one who's not responding to any biomedical treatments that do not include some other things that may not be thought to be connected with Lyme and autism and so on. About 15% of the cases that we've looked at, when we've narrowed down the ones that may have a higher chance of Lyme, particularly when they're not improving from some things that they either used to improve or when they got worse again after some recovery. So about 15% of some of our selected cases, we don't test for Lyme in every single child with autism. But if there's a risk, we do. If it's an obvious case, like they went whitewater rafting with their family when they were 4 years old, and then they sort of had a borderline case of a developmental issue with a little bit of a slow onset and so on, and then they delve into frank autism after that. That's the type of kid I'll test for Lyme. About 15% of the time we do find Lyme and some other tick-borne illnesses. I'd say the tick-borne illnesses total and co-infections would probably be more like 20%. And so it's another avenue to help our kids with autism and other spectrum issues get better. Mm-hmm. So the fact that many of the kids do have Lyme, that's a pretty darn high rate. If you take a look at the general population, ain't 15% of them have Lyme disease. No. Just not the case. But a very large number of kids and adults with autism do have it. A very large number of people who get Lyme have cognitive regression and physical illness that's very severe. And it often does involve their immune system, their GI tracts, and their cognitive neurochemical function, like the accountant I told you about. Mm-hmm. And there are cases of frank dementia, sudden onsets of schizophrenia in a 20-year-old, things that are thought to be catatonia and withdrawal from stresses in society and things of that nature. It really is a very strange question. Why wouldn't a doctor do everything he or she can to find out what might be the basis of it? Then, if we delve a little deeper, there are some cases that clearly the autism was brought on by the Lyme. And kids who get bitten at an age while they're developing language can develop autism from it. And so it's not every case. In some instances, the fact that the autistic child has a weaker immune system, and that's part of the illness with kids with autism, their immune system just are not normal. They get eczema, they get asthma, they get wheezing, they get croup, they get inability to defend their GI tracts against yeast and E. coli, and they get urinary infections and skin infections and prolonged colds. Their immune systems are sick most of the time, and they're more susceptible to the tick bite to get Lyme. Not every person who got bitten by that tick that week who has the Lyme and its tick body are going to get Lyme. Just like if I have a cold and then I'm in the room with a bunch of people, everybody in that room is exposed to the cold. Not everybody, as our friend Mayor Eisenstein, rest his soul, used to say, not everybody's going to get the cold. The people with a better immune system won't, and the ones whose immune system didn't defend it as much will get the cold, and they'll have to try to fight that germ. So it goes with Lyme. And when you have an autistic, weak immune system, you're more vulnerable to it. And we do therapies outdoors. We do equestrian treatments. We take the kids to the park so that they get physical input and get used to sensory, balance and so on and so forth. They're very susceptible to getting Lyme. That's all there is to it.
Is there such thing as a negative is there such thing as a negative Lyme test? So like, let's say you get tested and it says you don't have it. Is that possible? That could be wrong?
Yes, it is. We have legislation in Ohio that I helped to write that said that you needed to inform every patient you did a Lyme test on, autistic or not, that the test is not perfect. And of course, that's true of most tests. The Lyme test is weaker than other tests in the sense that you need to put it all together with ruling out other illnesses and having appropriate symptoms and having some testing that you try to do. But if the only likely phenomenon is other illnesses that that are not present on some more surefire tests, and Lyme is still high on the list, you could still have seronegative Lyme disease. Parenthetically, the more contrary doctors hired a full-time lobbyist to have that legislation repealed in Ohio. Oh, wow. Very sad. But we did have the law where you had to inform people that the test could be a false negative, and you could still have Lyme. We do that all the time with tests. You can have a normal EKG and have a life-threatening heart attack. What do we do in that case? If we think we've ruled out everything else, we're precautionary. We do some early treatments for the heart issues, and we do further tests, and we keep the patient in the hospital so they won't have a sudden death from the heart attack. And for a person bitten in a hotel room that has a bullseye rash, and instead of waiting around 6 months to see if she develops terrible arthritis and mental dysfunction, a few weeks of properly done treatment with an antibiotic and some immune support can be a lifesaver and stop a lifelong disabling illness from taking hold on a person's body.
Now, basically for kiddos, is there one type of treatment, for this, or is it like everything else with autism where maybe this will work, maybe that will work, this one's different, that one's different?
Yeah. Most people are going to need an antibiotic to get their best chance to have help to get treatment for Lyme disease at any stage. But if we put all our eggs in the antibiotic basket, it almost never works. Mm-hmm. If we forget that there are other co-infections and we just treat with one antibiotic for Lyme, it almost never works. Mm-hmm. And so we need to do prevention and or ongoing Lyme treatment in many ways. So we have about 300 treatments, and I say this to the children with autism, with herbals, probiotics. Some treatments are oral, some are shots, some are suppositories, some are detox, some are immune stabilizing, some support brain chemistry, some support the body's tissues at the mitochondrial level. A lot of us, of course, most of us have heard about that term, so that the body is strong enough to accept the treatment and to squash the Lyme germ without having to regress on and off. So just like the child with autism needs to have therapy, just like the person with a stroke needs to have therapy, if their stroke was caused by diabetes, we would do diets, we would do shots of insulin for the diabetic, B12 for the autistic child, so that their body can be stronger and so that they will respond to an antibiotic, so that their GI tracts won't be as susceptible to yeast when we use a probiotic like Saccharomyces or like a high dose of something like my friend David Berger did the work on the Lactobacillus Duo product and these kinds of things. These are the things that help our kids with a balanced program, just like the diabetic person who has a stroke. They get therapy, they get dietary intervention, they would have their blood pressure stabilized, their cholesterol, and that's what we do. And sometimes we use medications, sometimes we use all the other modalities.
Now, with a child with autism, is there symptoms that start appearing? Is there one particular, or I don't know, maybe 2 or 3 particular symptoms that appear if in the child with autism that maybe might give you clues that it could be Lyme disease? Because I know many people are watching, they might not have ever even thought about the connection. So, is there symptoms where they can say, hey, I really want to go make sure I'm tested or my child's tested? Is there traditional symptoms, I guess, is the best question to ask.
Yeah, and the doctor's motivation for that is to pick out a handful from that 300 set of treatments, which one would work for that child or are the best ones with the greatest likelihood, because we don't do all those treatments in everybody. So again, I mentioned some things before, but you mentioned the rash. Mm-hmm. The classic bullseye rash may happen, and we've seen this in several kids. Now with the co-infections, which are more and more common in the last, I'd say, 20, 25 years, there's often a purple color to the otherwise red bullseye rash, often in the center. That often means there's a co-infection there. Some people never get a rash, or they get a rash where you wouldn't look, in the scalp where it's covered with hair, under the arms, in the groin area, places like that. That's why the tick checks have to be all over the body, because that may be where the bite was. The other mistake, if I may say so, or if I were to do it, it would be a mistake for me to do it, to just look for rashes to develop where the tick was found, if they do know a bug bit them, or where they have this little dot of a bug bite, because the bullseye rash can be in another spot. And maybe that means there's another bite that we didn't know that the patient had, or the germ spreads to a susceptible area where there's, for some reason, maybe because of an old injury or circulation or reasons we don't know, but where the bullseye rash will show up. So those are more obvious things, but a sudden worsening for no good reason, okay, when nothing else would have happened, sometimes seasonal in the early spring and the late summer, and the fall is when this happens. Often when the kid goes into a shaded area, the ticks don't like sunlight. They like humidity, they like heat, but they don't like dry heat and they don't like sunlight. So a desert is not a likely area to get a tick bite except sundown. Then when you're in a cooler time, the ticks will start to be out, and the critters that are out at night and don't like to be in the hot, dry sun may come out when it's dusky, and the kids can get bitten then. In the shade under a tree is a common time, okay? And when you take your new baby to the park, or your 12-month-old to the park, you might shade them and lay out a blanket on the grass, or let them touch the cool grass and feel it, and things like that. And those are vulnerable times. We've had people who've taken their kid to the park, and then they come home and change the diaper, and in the groin area they see the tick biting the child.
Oh my goodness.
Yeah, so the ticks go for the warmer, softer skin. In our people of color, not only is it harder to see the ticks, but it's harder to see the rash. So this is, and the ticks love that color of a deer or a mouse, the brown, gray, darker skin, and they'll go for that. They really do. So they don't see well, but when they see something, they go for the darker colors, the fawn colors, the woody brown colors, and they do go for people who have darker skin. So our families, white, black, Hispanic, brown skin, many different types, who some of the Asian peoples and so on who have darker skin, who live in urban areas, patches of land that are just the size of my arm width, and a few birds flew from the bigger patch of land and brought a tick on the bird, and then the kid is just sitting on the front lawn or in a urban area, they can get tick bites. So it happens everywhere. It really does.
Now, the symptoms other than a rash is there, I know you mentioned some things of changing overnight, almost, some type of mental disorder, something totally out of the blue. So if basically, it doesn't matter what age, I would imagine if, I am a parent with child with autism, if I saw something that was just so sudden, to me, it's something that's so easy to rule out. Now, is there different tests, or is it just one straight Lyme test?
Well, the first thing is to listen to the parents or the patient, and they can have from head to toe headaches, new seizures for no good reason. They can have an episode where they got ill and they seem to be getting over it, feverish, kind of flu-like, and then they just weren't themselves after and they lost function. Joint pains and swelling, particularly if it shifts around, okay? The children who are younger with softer bones can actually get aches and pains that are in between the joints, and they can get bone and muscle infections from Lyme and the co-infections. And there's often assigned as growing pains. We have several patients who don't have any cognitive dysfunction. They have orthopedic pain. They have pains in the muscles, bones, and joints, and in the tendons. And sometimes it'll be, the children tend to have lower extremity shins, things like that. The adults tend to have them more in the hands. I would say when the adults go out and do hunting and farm work, and some of the rural workers, and do more work with their hands, the colder areas seem more vulnerable to that. These are the things that with these stubby type of joint pains, many of the kids start craving sensory input, or they start getting sensory defensive. and instead of picking up things normally with the pincer, their fingers and joints hurt, and instead of doing this, they'll do this, and they'll do this, and they hurt. And the acral areas, like the sensory defensive kids, if they suddenly get worse with that, then that's a sign that something changed. Many of the germs cause neuropathies, where their feet hurt, especially in the morning, and they get these burning pains. Sometimes the feet are red. And what we're used to when we think of phenol reactions with red hot skin happens on the fingers and the feet and the ankles. And the farther away the nerve is from the center of the body, which would be the legs, that's the more vulnerable area. So a lot of the kids will get these, and then some of the kids will start getting toothaches, and then they go to the dentist and there's nothing wrong. And the dentist says, well, it's TMJ, and there's nothing wrong with that. And the adults and kids will get these facial pains and tic douloureux and things of that nature. But other co-infections that we're familiar with, like strep and pandas, really come in and works as a bad actor friend to the Lyme germ and vice versa. So the kids who get pandas have a higher rate of Lyme, and the kids who have Lyme have a higher rate of pandas. So it's familiar territory with worsenings, and sometimes they'll get new onset pandas, and sometimes that'll be a sign that there's Lyme. And then the teenage girls especially seem vulnerable when they get the Gardasil vaccine to have an association with Lyme. So for reasons we don't understand, those are things that we see. And many kids have a much worse GI syndrome after they get Lyme. And Lyme loves to live in electrical tissues, the brain, the heart, the muscles, the nerves. But the GI tract is the biggest repository of electrical tissue in the whole body. Most of the GI tract's electrical. So these germs, the Toxoplasma, the Lyme, the Bartonellas, the Babesias, like to live there.
And is there one of your favorite treatments? Is there one that kind of seems to work? I hate to use the word universal because nothing's universal, but is there something that seems to work more often than not?
Yeah, I was asked this a long time ago when I gave a talk about some issues that don't seem to be related to Lyme or autism. And it was a question a resident doctor asked me when I was at the county hospital as one of the faculty members. And he said, well, what do you do to treat that? And I said, everything. And I don't mean throw the kitchen sink at somebody, not all the 300 odd treatments. I mean, it takes a multi-pronged approach. First, it takes eliminating the ongoing exposure to the Lyme germ. And many kids are rebitten. We start treating them, they get better, and then they seem to get worse again. We have to do tick checks. We have to do some of the natural tick repellents on the body surfaces, the citronellas, some of the pungent bitter bean extracts that you can find at the camping stores and online. And then some kids will get very sick with DEET and some of these synthetic forms, but some of those can be safely used on the surfaces of clothing and shoes. Okay. Then wearing light-colored clothing and tucking in long sleeves and long pants and doing, when you see the ticks crawling on the light-colored clothing, it's easier to detect that. And then tick checks, those are important. But the treatments involve some antibiotics, usually 2. For the children, we can sometimes use just Zithromax, just like we do with pandas, or Biaxin, or Bactrim, or something of that nature. But we do use herbals, such as the curcumins, such as elderberry, such as olive leaf, caprylic acid. Caprylic acid is a good antiparasitic, grapefruit seed extract, artemisinin, which is the wormwood. We use other parasitics like the green shells of black walnuts. So just like we often do with other issues, the germs don't like some of these natural treatments that are broader and milder than antibiotics. But as a lot of the parents with spectrum kids know, we've got to be very aggressive to protect their GI tracts if we use antibiotics.
Now, how long
we usually use some form of antibiotic. We use heavy-duty probiotics. We often use Saccharomyces because it prevents C. diff and fights other yeasts, because Saccharomyces is a good guy yeast, and it flourishes with antibiotics, so that's why we like it. Some kids don't tolerate the oxalates with Saccharomyces, so they have to use other probiotics, like some of these soil-based organisms that are out there, and there are a lot of good products in that realm. But some kids won't respond unless we use IV antibiotics and PICC lines, both to treat the disease and to keep the antibiotics out of their GI tracts. because there's less GI side effects when we do that. So we have a variety of treatments, and it usually takes doing multiple treatments. For the small kids who get some of the other forms of Lyme that may be from other means other than ticks, when they get it at a very early age, sometimes we just use herbals and diets. And I have one child I'm doing that on now. We generally have a handful of kids in the practice that's what we're doing. And they often respond if we catch them early, just like with the autism issues.
And how long does it take for like a traditional treatment of the medication? Is it 10 days? Is it a month, before you start seeing the symptoms get better?
Yeah, I'd say that we can see early improvements, but it often takes months of treatment. Many of the kids and adults that come to us, particularly the adults, have had chronic Lyme, not the acute Lyme, not the bullseye rash, and they went to a doctor within 10 or 12 days, and they got antibiotics and maybe for 3 weeks, and they're done with it. That's the shortest you'll see work, and I think your case you described was a very fortunate one, mainly because you were proactive, and you had to kind of fight, may I say, the doctor to try to get the right treatment.
I did not like me.
Well, our job as doctors is not to make a decision whether we like or don't like the patient. We have to not like the disease and treat it. Mm-hmm. And isn't that the rule with our families? We get dismissed by some caregivers who we go to for help, and then the horse gets too far out of the barn, it gets worse and worse and worse. So we have many people that get treatment for over 8 months or a year, and they steadily and slowly get better with treatments that they can tolerate, that we go a little slower and a little milder with multiple mild treatments, because that's much more tolerable than heavy-duty nuclear treatments, and they just don't tolerate it. Most patients can use oral treatments and don't need these IV, PICC lines, ports, but some people do need them because their GI tracts can't tolerate it, or they just don't get enough of the potent things that they have. And many of the patients have POTS and some of these other neuropathies, and they need other IV treatments and TPN and nutrition that because they're so sick, they just can't get it all orally. So I would say the average would be 5 to 8 months of major treatment, and the majority of that time does involve antibiotics, but we rotate them. So the gentleman I saw the other day who's getting better with his Toxoplasma, at first I didn't use any antibiotics on him. I strengthened his system. Some of the older Stephanie Cave-like treatments help control the yeast, stabilize the GI tract, assist the immune system, do some more testing, and over a period of 3 to 6 weeks, have the patient back. And then we build a foundation at that point and add other treatments to it, such as antibiotics, such as some of the stronger herbals. And the herbals can have side effects too. They can cause dysbiosis and leaky gut if we don't rotate and soothe the GI tract and the immune system. We find viruses like immune suppressive things such as CMV, HHV6, Coxsackie, we treat those too. So Coxsackie we treat with selenium and zinc, like our Asian brothers and sisters have taught us with some of the areas that are selenium and zinc deficient in the world, like our Middle Eastern Arab brothers and sisters have taught us where there's no zinc in the diet, they have more Coxsackie problems there. Whereas in the U.S., we have more mycoplasma and adenovirus. And so basically, we treat the co-infections and we stabilize the immune system. And many of the kids have accumulated toxic metals. Many of their parents are very toxic. And so if we don't treat the toxicity, sometimes we just won't get better. And some of the kids will need hyperbaric. That's a very strong treatment for parasites. And many of them will have tremendous die-off, and they have to have the tiniest amounts of hyperbaric. And we have some patients where we're not at full pressure for months, and we don't do everyday treatment for months, and they get 2 or 3 days a week for 20 minutes for months with no oxygen because we have to inch into it because we get tremendous die-off when we start to capture and corner the Lyme germs and the Babesia parasite germs and some of these Bartonella germs that are the co-infections. So we just have to be patient. And the patients who need slower treatment so they don't get too sick, I hate to say it, it's almost like cancer chemotherapy. They want to do them continually. We sometimes have to rotate so they can make stepwise gains.
Now, as you're talking, I'm thinking, well, what happens if you didn't know you got bit by whatever, spider, tick, mosquito, whatever it is, right? Let's say you didn't know. you got bit by that, and maybe you don't see symptoms right away. Maybe, I don't know, 6 months,
Right.
you start adding it all up and you think, well, gosh, like maybe it was that. Is there a certain age of like how long from the time the tick or whatever it was bit you to the time you discovered you had Lyme disease? Does that play a role in how, I guess, that, or I guess, what's the word I'm looking for? How hardcore, for whatever reason, I can't think of a better word, like you're attacking it, right? How hard you attack that, or is it, because it seems to me the earlier you treat it, the better, because you've already said it helps, you don't want to really get
Right.
into the cells, right? Into the body. What happens when you, maybe 6 months or a year, or who knows how long, is it still treatable at that stage?
Yeah, but it's harder the farther out. So for some people, if they get much past 3 weeks without being treated, then it becomes chronic. 3 months is really going to be a chronic phase. And then many people who are doing outdoor work, or the child that goes to the park or plays in their backyard, may be bitten multiple times. We're taught in medical school, what's the one time they got bitten and got Lyme? Kids can get bitten when they're age 3 and get dormant Lyme, where they're really not as healthy as we'd like them to be. They get some mild developmental delay. No one ever considered Lyme disease. Then when they're 7, they get bitten and they regress. We recently had somebody who was a teenager who regressed, and another one who was 20-something years old. When she was about 19, she had pretty severe Asperger's, but she went to junior college, was driving her car, was doing things independently, and then after that is when she became severely autistic.
That's
The
horrible.
latest case of regression I know of, and that's in our practice. I saw her the other day. She's almost got a catatonic case of autism. But she was sent to me because another doctor did a Lyme test, and that's when she regressed. So the sooner it's diagnosed, the sooner you can treat. So the preventive types, or the early cases, it may be as little as 3 weeks of treatment, antibiotics, probiotics may be it. We've had people who weren't diagnosed till 10 years after it happened.
Oh,
If you
no.
respond to treatment, it's much harder to do. So some people we treat and they get much better and get back to nearly a normal life. And then some months after we stop the treatment, they smolder backwards. And those are people we rotate maybe every 3 months. So in the early days when Dr. Buckley was working out the hyperbaric treatments, a lot of us who followed her early work found that it helped. But then when you stopped it, after some weeks, some people, kids or adults with spectrum issues who responded to hyperbaric, needed to get a boost a few weeks or a few months later. And so we followed that early learning curve that we had, that some people needed to get a boost, and they couldn't just do it and then stop after a while. So we learn in medical school that, oh, you kill the germ and you're done. Sometimes we forget what we learned in medical school, that you can have chicken pox when you're 3 years old and you seem to be cured from it. And then we know that chicken pox can come back when you're 70 years old, 70, in the form of shingles.
Mm-hmm.
And that germ's been there a very long time.
Mm-hmm.
And what's the treatment for it? The exact same thing. Valtrex, protecting the immune system, treating co-infections such as impetigo, which happens with those two diseases, which is what? Strep throat on skin. And we learned all that, but somehow when DeMio or a parent or a woman in an ER brings up these issues, we are dismissed and thought of as crazy,
Mm-hmm.
and the patients suffer because they don't get the treatment. So the longer and deeper the Lyme germ's established, the longer and deeper you may need to treat it. You don't need to treat it for 10 years, but that's where we may take our time with some stepwise treatments so we don't hit the patient too hard. Because sometimes we wake up the immune system too strong and we kick a bunch of sleeping dogs, the co-infections, the Lyme, the Panda streps, and PANS viruses, and we'll make the person very sick in too short a time. So we'll go slow and low, and we do that with all of our treatments, including hyperbaric, antibiotics, herbals, and even the diets. Every once in a while you get that person, you put them on the diet, and their body starts absorbing food, and the leaky gut starts to heal a little bit, and they start to get a lot of die-off and the tremendous release of yeast toxins and bacterial toxins, and they get sick. And sometimes we need to do charcoal and things and step into it slowly over 3 or 4 weeks' time. Otherwise, they get too sick. So the longer they've had it, the more we do need to treat, but we start gently within a few weeks or months, and that's the way I've done it, with our years of time with Lyme and autism together.
Now, for somebody, I can't believe an hour is almost up. This has been so fascinating. I'm just thinking for a parent right now, again, I guarantee you there's so many people going, how come no one's ever told me about this? How come no one ever talks about this? I mean, I know in our world we hear it, but if you're brand new to this is probably something you've never even could have imagined that this could somehow, be connected. What would be the first steps, action steps that you might want to give a parent who might be thinking, okay, I know my child has autism, and gosh, I was listening to that Dr. DeMio, and he was saying X, Y, and Z, and, maybe I should just, get my child tested, but I'm also thinking of when I was in the ER, and here I have this bullseye, bite, and they're like, no, we don't really need to test for Lyme. And I'm thinking, I'm showing the pictures on Google going, but look, it looks like this. So what do we help those families? Obviously, I know they can go to you, and I know they can maybe go to other places as well. What's your recommendation if they can't get to you right away?
Yeah, I would say if a doctor is dismissive, there's almost no harm in rapidly getting another opinion. Mm-hmm. And sometimes that means going down the street to another ER. Sometimes it means the next day going to your primary doctor and say, look, I understand this is controversial and that not a lot of doctors have seen cases or believe in this, because ain't that the way our autistic lives go for our children, mm-hmm. and for us as parents, and for the few of us out there as doctors that believe in this, that many other doctors, often the majority of other doctors, don't believe in it, and they'll be dismissive. Some parents have a fear that they'll be reported to Child Protective Services as Munchausen by proxy and all these terrible things. I would just go to an understanding doctor that is open-minded and is willing to listen. And like a lot of other situations, Doctors Data and Genova and Great Plains are familiar with testing for heavy metals the right way. Mm-hmm. And not all the labs are familiar with testing for Lyme the right way. There's the IGeneX lab, there's the Galaxy lab, the Milford lab, and sometimes you'll get a positive at a regular lab. That's good, but that's what our legislation in Ohio is all about, that not every lab does the test the same, and they're good labs. And when that test shows Lyme, then the doctor may say, oh, okay, maybe this is Lyme, but oftentimes they'll say it's a false positive and that it had nothing to do with your child, and boy, oh boy, it's a real challenge. And you don't always have a positive, and with things such as the person with a fever who's coughing phlegm, the doctor may not wait for the culture from the phlegm to show pneumonia. Mm-hmm. And if the x-ray doesn't show pneumonia, but they hear it or they think that's the most likely thing, they're not going to wait for the infectious disease doctor tomorrow to do a consult with a sick older person in the hospital. They'll treat for pneumonia by using antibiotics, IV fluid, mm-hmm. proper nutrition, fever control, okay, pain control, and things that are helpful to the immune system, like stop smoking and things like that. So it goes with a child who may have Lyme. Sometimes, even though some of our kids are very susceptible to antibiotics, sometimes, although we did due diligence in looking for a positive test, we may need to do some treatment and figure that we need for about 3 weeks to send off other tests. If we find 3 tick-borne co-infections that are positive on a test, even though Lyme test didn't show it, that kid's been bitten by a tick. So we can treat for tick-borne illnesses with the proper treatment, and oftentimes they get better. Sometimes there's nothing showing on a test, but the doctor suspects Lyme, and we treat for it and they get better. And that's sometimes indisputable, mm-hmm. as the proof that the child had Lyme, okay?
And that's the main thing, is you just want your child to feel better and so they can do better. And if you're already battling just the symptoms of, autism in itself, right?
Well, we want the autism to get better if we think the Lyme may have a hand in causing it.
And that's the whole thing, and it's like, gosh, if this could help, like if this is such an easy thing, I don't understand why. To me, it almost seems, and maybe it'll be you that gets this into the rest of the world, maybe, I don't know. But when you get the diagnosis of autism, I really feel like there should be a whole lab work. Like I know when I got my diagnosis, it was like, all right, here's a brochure. Maybe look at some speech therapy. maybe look at some OT, but imagine if we get to a place, which I do believe will be in my lifetime, because I'm hearing more and more of mainstream talk about autism being autoimmune, autism having all these other conditions, where 14 years ago, that just really, it was so rare. You had to go seek it. Now, I was like watching something online, and it was, I think it was CNN.com, and don't quote me on that, but it was something like that. And they were talking about, oh, guess what? We're now figuring out that there's a group of children with autism that have all these autoimmune issues. And to me, I'm like, really? You're just figuring that out? Because we've been talking about it for well over a decade.
Decades.
Yes.
Yeah.
And so I'm hoping that it's somewhere near in my lifetime, because where you get the diagnosis and they say, okay, we're now going to send you to this particular clinic or hospital, and they're going to then test you for all this stuff, whether it be yeast, Lyme, bacteria, whatever. Just want a whole array of tests. And then they can say, oh gosh, this is what's looking like on your chart here. It looks like you have a lot of heavy metals. It looks like you have this. It looks like you have that. Now, I truly believe that, because I can't imagine otherwise, so it's always in my mind. You have St. Jude that helps with cancers. You have the Ronald McDonald House that helps with other sicknesses. I believe there'll be someone somewhere that has Oprah kind of like money, right? That this happens to their child, and they say, well, wait a second. Why is there not a hospital? Why is there not a hospital dedicated to these children, so when they get sick, or like they're having some issue, or they first get the diagnosis that they go there, they don't have to worry about the money. Just like St. Jude or Ronald McDonald House, right? The families go there, and you don't leave there until that child is at least having a high quality of life of some way, right? Because I truly believe autoimmune can do better, right? And I know you believe that too. And it just seems so, I know it's going to happen. I really hope it's in my lifetime, right? But I just have to believe that if mainstream are coming out now saying, oh yeah, by the way, we know there's these autoimmune, well, wait a second. Then why not help all these kiddos, right? Why is it, what did you say the percentage was, 15% or something like that?
I think we see about 15%. I think it's probably
ridiculous.
higher if you're near an area and you have a lot more exposures. Might be lower if you live in a desert.
But either way, that's just mind-blowing. And so I just can't thank you enough, and doctors like you. And there's really, honestly, the people that are watching, guys, there's really, in my mind, maybe 20 doctors that I can even think of. If that might be, and that's scary that we live in the United States. Obviously, I'm biased because I'm born and raised here, so I'm very proud to be from the United States. If there was another country that had more doctors, I promise I'd be moving there right now. But, to me, I don't understand how we can be such a powerful country and have approximately 20 doctors that have dedicated their life to trying to help our children with autoimmune and autism. So I can't thank you enough as a parent for doing what you do, because I know you sacrifice so much of your time. I know your wife, his wife, by the way, guys, is, hi Joyce, like Joyce is just so amazing. And I know he sacrifices so much of his time away from his family, because his mission in life, like so many of the other 20 approximate doctors out there, right? Your guys' mission is to help our kids. So thank you for that, Dr. DeMio.
Well, the patient always has the hardest job. The family has the second hardest job, and I won't say that the doctor's job is easy, but it's straightforward, and all we want to do is recognize that these issues, whether it's Lyme or autism or the blend of both of them, are medically based problems, and we think our patients should be free to be able to know about that, and they shouldn't have to make the diagnosis. It should be that there is an awareness of this. And I think that there will be. It's slow coming, and I just think I'm proud to be an American as well. But I'll tell you, sometimes my pride makes me wonder why there's fighting about it. That's when maybe there's not enough good doctors and too many ones that maybe need to think about Lyme and the medical basis of autism more.
But it's not even just the United States. It's these other, I don't know any countries that are like experts of making the autoimmune issue in autism 100% better or 80% better. So I think we just all have to keep coming together, knocking down doors, saying, hey, we're here, listen to us, because I love when you read a little section in the newspaper and they go, oh, we just discovered this. No, you didn't. I'm glad you're talking about it finally, but we've been here a while, and we're doing our best. So I want to tell you guys, if you guys love this interview, which we have over 25 of the top experts when it comes to whether autism or nutrition. When we were saying 20, those are more of doctors, but we have nutritionists, we have play therapists, we have other people on this summit as well. And if you love watching this and you're like, gosh, I wish my significant other could have watched this with me, or I wish my family member could have watched this so they could understand more, you guys can go to autismhopesummit.com and you can buy this whole package, and you can have Dr. DeMio forever, like watching him over and over again. So it's really easy to do. All you have to do is go to the website, buy the package, and here's the cool part too. Every package we sell raises dollars for the Autism Hope Alliance so that we can give more nutritional scholarships to more families across the country. So for me, it's a win-win. We're giving you guys education. These amazing doctors and experts have come out, and on top of that, we can raise dollars to help even more families. Now, I want to end with, all of these families out there watching right now, Dr. Mayo, regardless of the age or if they're newly diagnosed or they've been diagnosed for a long time, what kind of message do you want to leave them with?
Just that these problems are medical, and they have a medical basis, and they have a medical treatment. I would say that the stress and the quote-unquote non-medical things, emotional stress, quote-unquote psychiatric problems, sometimes as doctors, we're taught that those are something else in a corner. They too happen inside the body, and I'd say your kids need everything that involves therapies and medical treatment for these problems. And we try to do what we do for any patient who has an illness. We pick treatments that have the lowest risk. We be aware of the side effects that are negative, sometimes more serious. And just like if your child had leukemia, you wouldn't want to withhold treatment. I'd say that it's not that serious in terms of side effects and so on and so forth. But it's a long road, and you want to help your child. The kids just want to feel good, and they just want to be happy. And they have the right for that, and the parents have the right to pursue the types of treatments along with ABA, along with floor time, along with DIR, all these different treatments to help their kids get better. And just like the diabetic person with high cholesterol and high blood pressure has a stroke and they go to the hospital, they get a CAT scan, they get blood counts, they get IVs, they get shots, they get this and that. Nobody says, is your mother a bad parent? Nobody says that. They get medical treatment, they get special diets, they get shots. And that's all we want to do for our kids. Not those very things for every kid, but the right thing medically. And we shouldn't have to fight a political fight. Unfortunately, today, that's somewhat the way it is. And the treating parent and the treating doctor is still not as common as it should be. And we need the freedom everywhere from the regulatory agencies to the acceptance by friends and neighbors and family. It's really important. Absolutely. No one would ever object to a hospital for kids with cancer. You mentioned one of them. No one would ever object to a burn unit for kids who got burned. That's the Shriners. They do great things. I used to work with them, and I still do on occasion. But this whole thing of objection to treatment for Lyme, which is a political hot potato, just like medical treatment for autism is, shouldn't be, but it is. And so parents should be ready to know that sometimes they have to persist, dare I say, fight for it. And so it's something that can help people, and it's not perfect, but it's the way we treat by meticulously going over a lot of treatments with diets, detoxification, often with antibiotics, and careful attention to the GI tract and the physical health. We want the kids to grow, their cognitive problems to improve, and their physical bodies to be healthier.
I think that's a great message, and again, thank you for being here, Dr. DeMio. I know your schedule is crazy busy.
Thank you.
And for all the parents watching, the very last word I can say is hope. There's definitely hope with a plan. That's what this summit's about. And you know, doctors like Dr. DeMio, they're not giving up, and parents like you and I, we're not giving up. So until next time, bye guys.